Let's bring him in. My good friend, Dr. Joe Congini, part of this morning show for over 30 years. And Joe saw the official announcement. You and I have talked a few weeks ago. Congratulations, my friend, announcing your retirement, and well-deserved, Joe.
Thanks, Ray. I was overwhelmed by the response,
Yeah.
but it's really a function of the team. We have such a good team down at Children's in sports medicine, and so blessed. And I am in this. I don't even know exactly. I told you at the beginning what it means, this emeritus status, but I'm to be involved in strategy and teaching and some committees that I'm involved with and stuff like that, and consultation. So I still have my hand in it for sure. I'm keeping an eye on this sports medicine center that we've kind of built here at Akron Children's Hospital. So thanks, Ray. Thanks for the kind words.
Well, fabulous. And, Joe, those great teams don't happen by accident. I always say business, teams, medicine, it starts at the top, and you're right up there, according to many people, including yours truly, of the job you've done.
Thanks. So today, talking about teams, it's an exciting time of year, man. This is our time of year. You know that. You get excited. I get excited as the kids now are returning to fall sport season, heavy sports season. And everybody now, by August 1st, when the calendar turns, we're getting a little more serious about sports like soccer is getting ready to roll, and volleyball and all the fall sports. And the football people are putting their equipment on at the high school, college, and professional level. So it's a pretty exciting time. But one of the things that I wanted to talk about today, it's also a time where we really ramp up our concussion clinic. And speaking about a team that really does it well, our concussion clinic I'm just so happy with what a great job the way it's developed over the last 20 years. They really work together and do a great job in getting kids in early, getting them on treatment early, getting them in protocols and back to health. To a rate to 80 to 85% of kids do well. But we do talk here, unfortunately, about the 10 or 20% who don't do well. And I want to talk about one of those groups today. And so, Ray, I think we've talked about the fact that there's so many different functions that the brain has. When we have concussions, there's really 6 different types of concussions. And I think we've touched on all of them a little bit through the years. You know, the one that a lot of people think about, the cognitive, where we have problems with memory and thinking, number one. Number 2, the balance concussions, the vestibular, which are kind of scary. Like most concussions, they get well, though, usually in the first 7, 10, 14 days. Oculomotor, or the visual concussions, number 3. Number 4 is the neck, cervical concussions. We unfortunately lived through that through the wonderful athlete JOK, who we see. So these can be mild in a lot of cases and treated easily, or they could be career-threatening, as they are in JOK. And the mood disorders are really tough to deal with. Upwards of 40% of kids who are concussed have some degree of anxiety and depression. But number 6, kind of the final one, we haven't touched on much, and that is the significant headaches. The migrainous component is the fancy medical word we call this area, migrainous concussions. And it's kind of interesting, we haven't talked about it much. Headache is the most common symptom that athletes get. Thankfully, with early treatment, again, we do a pretty good job. That 80% of people respond to routine medicines and relative rest and gradual return back to their protocol, and they do well with anti-inflammatory medicines or supplements. The hot supplement in the last couple of years has been magnesium. A lot of these clinics, and our clinic is using magnesium quite a bit in getting these kids better. But unfortunately, hey, what about that other 20% you're talking about? We have 20% of really significant migraine people, particularly people who had a family history or a past history of migraines. They're really at risk for these more significant migraines. We're so blessed. Our concussion, the director of our clinic is Tammy Murray, a nurse practitioner who's now been with us for about a decade, 10 years. So in concussion, she's seen about every type of concussion you can see. She sees 6, 8, 10, 12 concussions in a day. And so she's seen all these things. And so it's really hard if you see one or two a month or one or two a year as to, what are we dealing with here? And yet she does such a really good job. And in those migrainous ones, they either come in early on and we can't break the cycle of these very significant headaches, or they get the delayed onset on day 2, 3, 4, where they get into significant headaches and really bad, where we need to have them evaluated even in the emergency room. Or one thing that came about 15 years ago, Ray, and it's been so helpful for athletes and others, is what's known as the infusion center. And our wording for it is kind of the headache cocktail. So we bring these kids in, and we end up having to put them in a special quiet room. If it's in the nighttime, it's in our emergency room. During the day, it's in our neurology clinic, and run by one of the best neurologists in the state of Ohio, Dr. Chris Victorio, a good friend of mine, who is our neuro director. And in the cocktail, there will be a very strong pain medicine like Toradol. There will be Benadryl. There will be something for nausea, like a medicine called Zofran. We'll use the supplements, different supplements, but particularly, again, the magnesium. And with these cocktails, we have a really good success rate of breaking that unbreakable pain cycle that these kids are going through. And boy, if for migraine people who have been through one of those cycles where you just can't, it's called intractable headaches, just can't break the cycle, it's pretty scary and very difficult to deal with. So the what we do with the headache cocktail, the infusion center, is number one, we drop the histamine. We see that it's a big histamine response to these migraine headaches. Number two, there's medicine in there that allows these kids to rest, and the rest really helps. Number three, they're significantly nauseous, and they feel sick to their stomach all the time, and the medicine in the cocktail helps get rid of the nausea, and it really hydrates the kids. And it's so encouraging to see how well they do. Now, occasionally they'll have a recurrence, but they do so well with the cocktail. I'm so glad, because I remember the days before 15 or 20 years ago. What did you do with these kids? You just had to keep, dialing up the very big, strong pain medicines is all we used. and the headache cocktails, the infusion center has done a great job breaking the cycle. It's strictly a team effort. You have to recognize the type of concussion that it is. Our athletic trainers and physicians and our concussion specialists, and then when we need them, our neuro specialists like Dr. Victorio, are all involved in the right time to use the infusion center. And I just don't know how many people were aware of that at the end stage of some of these really significant migraine headaches related to concussion, we now have a pretty effective treatment known as the infusion center. And I wanted people to be aware of the advances that medicine makes that are really beneficial.
Yeah, that's one of those stories, right, Joe, that might not get the headlines, but it's been so advancing in helping out these kids.
It sure has. Oh, my gosh. So to see these kids they're just beside themselves with these intractable headaches, and to see them do much better, and they're back in the protocol within 2, 3, 4 days, and then they're moving back towards returning to play in a week or two. And so it's, not that return to play is everything, but if that's what these kids want to do, but seeing them just beside themselves with the really significant headaches, and now having a good tool any time of day. If they need the infusion center in the evening, our emergency room is equipped during the day in our neuro center. I wanted people to be aware about migrainous type concussions.
All right. Great information as always, my good friend. Thank you, Joe, and we'll do it again next week.
Sounds good, Ray. Take care. Have a great week.
You too, my friend. Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital. And by the way, even though he's retiring, he's still going to be a big part of this morning show that he's been a big part of it for 30 years plus.